They go home, and once they go home, they actually return to some activities right away, often doing things like going to one of their kids' baseball games.
Hi, this is David Dutton from HoustonWeightLossDoctor.com, and this is another episode of the Houston Weight Loss Podcast. I'm on the phone with Dr. Clifton Thomas, Houston's most respected bariatric surgeon. And what we're going to talk about today are just some of the top questions that Dr. Thomas gets when it comes to Houston weight loss surgery, any type of bariatric surgery. So, Dr. Thomas, are you there?
I'm here. Hello, David.
Hey, good morning. Thanks for doing the call. We've got about 6 questions that seem to be the top questions people are asking you. So what we're going to do is just go through each one, and I just want to have you kind of elaborate. Let's just say that someone has done the research, they decided that they really want to go through with the surgery. How do they get started?
Well, they're getting started by asking questions, and that's probably the biggest obstacle that any of them have is trying to, they've figured out that diets don't work. Now what can I do? Maybe I ought to consider weight loss surgery. So start by asking questions. Then they go to the website, learn more about weight loss surgery, tap into some of the education that's on our website that goes through different modules on gastric bypass, the sleeve gastrectomy, and the lap band, and become a little more educated. Then they call and make an appointment, and we give free consultations for people to come in, and it's really an educational visit where it kind of starts the ball rolling and find out if surgery is right for them.
Okay. Let's say someone wants to do the surgery and they have the consultation with you. Typically, how long is the process?
The process varies from person to person based on their insurance, and insurance companies sometimes require a few things to be done. One is consecutive monthly diets by a dietitian, and it's something that's never been proven to help patients medically, but it's something they require. So currently most of them are down to about 3 months of consecutive diets. Some don't require it. Again, it's something that's never been proven to be effective. So if they do not have those requirements, the next step is frankly finding out that their medical problems are stabilized and otherwise a good candidate to go to surgery. Once that's happened, actually we can proceed pretty quickly.
Gotcha. Which leads me to my next question. How long does the surgery actually take?
The operations generally take about an hour. Lap band's a little quicker, but the gastric bypass and sleeve gastrectomy are somewhere around an hour. Most patients go home the morning after surgery. With the lap band, they tend to go home the same day of surgery. But I've gotten where I do more gastric bypasses, more sleeve gastrectomies, and those generally go home the morning after surgery, generally doing everything within a week.
Oh, wow. Which is actually another reason why someone should look at the sleeve surgery versus having lap band. I know we talked about that on another podcast, that it's kind of a more outdated procedure, so the sleeve will help you, recover quicker.
Well, the sleeve definitely does more of the work to help you lose weight, help you keep it off than does the band, and that's because there's some chemical changes that go on in your body that truly does some of the work for you. So it's a better tool, and that's the way I like to think about it.
Cool. So how long was the person usually in the hospital?
Usually overnight, and sometimes one more night, but that's all. They go home, and once they go home, they actually return to some activities right away, often doing things like going to one of their kids' baseball games, maybe the second day after surgery.
Wow. That is amazing how far we've come along. The next day, a couple of days after, you're just kind of returning to normal life. That's amazing.
Oh, it really is amazing because I've done it long enough to have seen it both ways.
Oh, wow. So the big question that people are wanting to know is, how much weight will I lose?
Yeah, that is interesting. What's interesting about surgery, there's something that magically goes on about surgery where people tend to lose somewhere around 12 to 15 pounds that first week. Now, that's a water weight that our body's really holding on to, and it's weight that diuretics and those kind of things really don't get rid of. And it's a very unhealthy weight. So it's not muscle and fat that you're losing. It's water weight that your body's trying to hold on. And so after you've lost that 12 to 15 pounds that first week, you already feel a whole lot better. So patients walk into the office a week after surgery. They look like they've never had an operation. They're already feeling better. Their blood pressure's already better. Their diabetes is already better. And it's pretty amazing to see that rapid of a response. Generally, by the end of the first month with the gastric bypass or the sleeve gastrectomy, they're going to lose somewhere in the, say, 25-pound range for the first month, which may be 25% of what they need to lose. It may be more. But in general, with these operations, we're talking about getting to their desired weight sometime within a year.
Okay, that's awesome. They've got to feel like $1 million. I know they're recovering from surgery, but, after the surgery, it's just got to be an amazing transformation. I've seen some of the pictures of your clients, and it's hard to grasp. Is that the same person,
It really is amazing. I've again been doing it for quite a while, and I enjoy seeing it and amazed every day, as well as the patients and family and everybody else involved.
So let me ask you this: does the procedure ever fail? Is there actually a chance that someone will gain their weight back?
We do have failures. There's more failures with the lap band because, again, you don't get the chemical changes in your body that helps you do some of the work. But with all three operations, the most important thing for long-term success is to stay focused, start developing good habits, good eating rule habits, because in the beginning, particularly with the gastric bypass and the sleeve gastrectomy, you're kind of driven to do that anyway. So it's a really good time to establish those habits, and I think it takes 1 to 2 years to get habits firmly established. If you rely on the operation to do all the work for you, then you're going to regain some weight or possibly regain a lot of weight.
That's one of the things I want to talk to you about here in the future is developing good habits. I know you try to actually live the life that you teach your patients. You try to live a balanced life, and I know you go to the gym every day. So in a future podcast, I want to talk about how do you personally, develop good eating habits and good, exercise habits and that type of thing, because it's really important, as you just mentioned.
I'd enjoy that. It's something I spend a lot of time with, something we talk about every day in the office when patients come back.
Good. One of the cool things that I know your office does that I know not every bariatric surgeon does in Houston is you have a nutritionist on staff and I believe a counselor, correct me if I'm wrong, but a counselor that kind of works with people after the fact, after they have surgery, so people can actually, continue their success and they don't gain the weight back.
Well, that's correct. And more recently, we're trying to kick that up several levels where we can have online access to both the dietitian for nutritional information, how to shop, what to buy, how to eat, and also with our counselor for just emotional support. One thing that she does right now, she talks to patients after that first visit, because I've recently realized that first visit is a really big thing for patients. They've really had to overcome quite a few obstacles to ever get into the office, and it's hugely emotional, and they're blaming themselves for not being successful. So it's a really good time to talk to somebody that I did a gastric bypass on 8 years ago, and her background is counseling, and she's just a warm, fuzzy person that's easy to communicate with and kind of understands what they're going through.
You said she was actually a patient of yours?
Yes.
Oh, wow.
I did a gastric bypass on her about 8 years ago.
That's amazing. That's really cool.
And then our dietitian as well. She's extremely knowledgeable. One of her big jobs is, frankly, providing the insurance companies with the information they need. But we are going to really try to tap into her amazing knowledge and her ability to teach and share that with patients.
Oh, that's very cool. And again, this is not common. I mean, you would think it would be common with a lot of physicians, but what you're offering is not that common. So it's really good to take advantage of that.
A lot of physicians have dietitians on staff and have access to emotional counseling through colleagues and things like that. But the online webinars and the access in that manner, as well as phone consultations, that's not done a lot.
Mm-hmm. Yeah, and that's extremely important. So let's talk about the last question. It says, does Dr. Thomas take out of the area or out-of-state patients? Talk to us about that.
I will. So the lap bands, in my mind, is not a real good choice for people traveling to have the procedure done because the office follow-up is intensive. They often need to come every 2 weeks. They need to easily be able to get from where they are to the office. And so the lap band, with the lap band, you're much more likely to have failure by not being able to keep this intense office visit regimen going. So I don't choose to do people traveling for lap band surgery. But the sleeve gastrectomy is it's a pretty safe operation. It's a pretty easy operation for people to travel, get the operation, get some education, go home, and then start doing a lot of the follow-up over the phone and through these webinars to give them the support they need for long-term success. The gastric bypass is a pretty complex operation. It's not an operation that I encourage people to travel with because you really want to be there if they're having any issues after surgery. We have a very low incidence of complications, as low as any in the industry, but the fact is they can happen, and you want them to be fairly close to you within a couple hours.
Okay, awesome.
So the sleeve gastrectomy again it's a great operation, and I've had patients that travel. They usually know of me through another patient, but they travel from another state, and they've done very, very well.
That's great. That's interesting to know. You actually educated me about that as we talked before the call. I didn't know people even did that, but it makes sense. I mean, especially if someone had already had success with you. You've got tons of success stories, and, people like to do business with, people they know, like, and trust, and, this is a very serious topic, and so if they've had a friend that's had success with you, then, they're definitely interested in traveling, of course, because they know that you're good at what you do.
I agree. It's the best way to get any patient.
Well, thank you so much for doing this podcast. I really appreciate it, and we will